welcome. Today I'm joined by Dr. Kirk Knowlton from the Intermountain Medical Center Heart Institute in Salt Lake City with me. Hi there. And we're going to talk a little bit about some of the resources and things you're involved in at the Intermountain Medical Center Heart Institute. Tell us a little bit about the Heart Institute and some of the things that you are doing.
Right. So as you know, Jess, I came from University of California, San Diego last year to join the Intermountain Heart Institute. And there are several things that really attracted me to come here and try to make some unique discoveries. And some of those include the fact that, one, it's a great medical center. It's a great place to receive medical care. There's a fantastic group of cardiovascular physicians and advanced practice clinicians. So it's a great place for care, and that's paramount. But number two is they've been keeping such excellent medical records here for so many years, actually starting in the 60s, way ahead of the game, and with very extensive records since the 90s. So we can look at outcomes of different patients with different characteristics. And then you combine that with a project that Dr. Muhlstein and Dr. Anderson started back in the 90s as well, where they were collecting plasma and DNA samples on patients who had atherosclerotic cardiovascular disease. And you can put those two together and we can start to combine the biology with the actual medical outcomes and figure out what are the important parameters that might help us to prevent disease and treat disease better in the future.
You mentioned the DNA repository. It's one of the largest in the world. Tell us a little bit about that and how do you use that?
Yeah, so there are a variety of different ways that it can be used. One, obviously, we can take and do what a lot of people are doing in terms of looking at different variants that occur with the DNA and comparing it to clinical outcomes. And we do collaborative efforts. We participated with the Broad Institute. We participated with Duke University and Stanford University, many major medical centers that are trying to understand how genetics contribute to disease. But I think one of the really unique things that Drs. Anderson and Muhlstein recognized was that plasma would be very valuable. And there aren't a lot of places that have plasma where we can look at proteins and microRNA levels and metabolomic levels in the plasma of those patients and try to understand more than just the genetics, to put more context to it about the environment and the genetics, etc.
Now you oversee cardiovascular research at the Heart Institute. What are some of the things that you want to do? Are there some studies and some areas that you really want to approach?
Right. So in addition to the things we've been doing in the past, we're very interested in developing pragmatic, real-world clinical trials. Because we have a very large network at Intermountain, at the Intermountain healthcare system in general, that basically encompasses all of the state of Utah, some of southern Idaho, and there are 21 hospitals, about 150 clinics, and we can bring all those centers together and do large-scale trials that are very pragmatic, that hopefully don't cost very much money. So, for example, we're very interested in learning whether a CT coronary angiogram can help us predict who needs aggressive prevention with a statin medication or other cholesterol-lowering medication before they ever have an event, and whether that will even add substantially to some of the cohort guidelines that currently exist using cholesterol and other measures.
That's exciting. What about your vision, your philosophy of cardiovascular research? Ultimately, what are we trying to do?
Well, so ultimately, obviously our goal is to prevent disease. Those that have disease be able to recognize it early, treat it the best way possible, and help people live high-quality lives. As we say at Intermountain, live the healthiest lives possible. So that's the ultimate goal. But we believe that combining historical records and thinking about it from a biological perspective in terms of what some of the biology associated with the changes that we observe is also very important, so that we can then collaborate with other medical centers or pharmaceutical industries that are interested in developing new therapies or preventive strategies.
And there are dozens of current collaborations underway with major institutions across the country, and really you're building this network and this collaborative effort to really broaden the efforts to study heart disease causes, improve treatments, all those types of approaches.
Yes, indeed. Yeah, that's exactly right. And I think that genomic genomic data analysis is starting to expand beyond just one center, and it's going to many, many centers and collecting data on from many centers. We've been involved in the atrial fibrillation genetics study with the Broad Institute, and there are many centers involved in that, including some of ours. We also think that this pragmatic approach is really important, and we're participating with the adaptable study, which is just we're just getting enrolled in to test what's the right dose of aspirin. So I think that there are many things that we can do, but there are many things that we can do as a collaborative effort as well. And at Intermountain, our goal is to find good answers to science. That's the most important thing that will help patients to help us to understand how better to manage our patients.
Well, it's great to have you at Intermountain Healthcare, and we appreciate your time. We invite you to join us at the Intermountain Medical Center Heart Institute booth at the HA Scientific Session. Come learn more, meet some of our clinicians, and learn how collaboration can take place. We also invite you to visit our website, where posters and abstracts will be posted, and you'll be able to access those resources. Thank you for joining us today, and have a great day.
Thank you.